We are joined today by physicians across Georgia who will share why it's critical for Congress to extend the enhanced ACA premium tax credits for not just their patients, but for hundreds of thousands of Georgians. Before we begin, I'd like to note that the physicians are speaking today as individuals and with the committee, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves on this call and not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. D'Alessio.
Hello there. My first name is Santa. My last name is D'Alessio. I've been a pulmonary and critical care doctor for more than 25 years, currently working primarily in critical care. So this evening, my fellow physicians from across Georgia and I are coming together because we're concerned about our patients and the hundreds of thousands of Georgians who could have to forego health care very, very soon. Over the weekend, open enrollment began for Americans who purchased their health plans through the Affordable Care Act marketplace, and many of our patients get their health care through Georgia Access, the Affordable Care Act marketplace in our state. Many of them qualify for the enhanced premium tax credits, which provides tax relief for hundreds of thousands of Georgians, helping them afford the premiums for their health coverage. In fact, in 2025, Georgia enrolled over 1.5 million Georgians are more affordable. Because President Trump and the Republicans in Congress are refusing to address healthcare costs and extend the tax credits, premiums will become unaffordable by many families. Estimates project that as many as 340,000 Georgians or more will simply not be able to pay for healthcare. And today I was actually speaking with a patient. Her premiums are looking to go from about $465 a month to over $1,200 per month, and her deductible would skyrocket. She could incur up to $21,000 in out-of-pocket costs with a $12,000 deductible. So this is just astronomical. These are people who have small businesses. They buy their own health care. People who are self-employed, folks who don't get coverage through their workplace, and even some older Georgians who aren't old enough for Medicare, and many more. My concern is that when healthcare becomes unaffordable at the outset, it ends up costing our country billions of dollars in the end, as patients do not get early diagnosis of diabetes, heart disease, hypertension, cancer. They forego basic screenings. And additionally, we end up having many more patients come into the hospital at end stages of their illnesses because they weren't diagnosed early on. And we find that they have no connection to a primary care doctor. So what will often happen is they have unestablished relationships in the outpatient setting, and they may end up coming in so far in late stages of their disease that they're spending thousands and thousands of dollars, and we're not even able to help them. In Washington, our U.S. Senators John Ossoff and Raphael Warnock are speaking up for people's health care and refusing to let politicians hold people's health and safety as a weapon during the federal government shutdown. And I believe this to be so incredibly important. A small but growing number of Republicans are also voicing their concerns now about taking away people's health care, including Georgia's Representative Marjorie Taylor Greene. While Washington's politicians are playing games, the consequences of holding people's health care hostage to score political points on ordinary working folks in Georgia is going to be devastating. Physicians across Georgia are extremely concerned. We're concerned about our patients losing access to health care that can improve their health, their safety, their well-beings, and the length of their lives. And we urge Georgia's congressional delegation and President Trump to put people ahead of politics and protect Georgians' access to affordable health care. Thank you.
Thank you, Dr. D'Alessio. Now I'll introduce our second speaker, Dr. Spargo.
Hi, my name is Bethel Spargo. I practiced pediatric endocrinology for about 33 years and for the last 25 years in South Florida. About a year ago, I retired to the beautiful hills of North Georgia and am currently not practicing here in Georgia. I'm still plugged in to what's going on, however. During my career, I cared for thousands of patients with a wide variety of chronic illness, ranging from hormonal disorders due to brain tumors, disorders related to growth and development, pubertal disorders, transgender patients, and of course, as Dr. D'Alessio alluded to, also diabetes. I think we can all agree to the importance of access to affordable healthcare, and that healthcare should be a right and not a privilege. It's clear how this access improves the lives of patients living with chronic medical conditions, as well as those of us who are lucky enough to be otherwise healthy. An insured patient who has diabetes, for example, is more likely to manage their condition better, see a doctor regularly, get treatment and therapy, and take their medications as prescribed. However, when that healthcare access is taken away, patients may not see a doctor. They might stop or ration their medication because they can't afford to buy it, and they may delay crucial care. All of these things can lead their diabetes to spiral out of control. It's not uncommon to have patients admitted to the pediatric intensive care unit in near coma from ketoacidosis for these reasons. And this same happens in the adult population as well. Where I practiced, many of our patients received Medicaid. We also cared for many uninsured and underinsured patients and quite a number of undocumented families as well. When families did not have insurance, parents might have to choose between paying for medical care, including life-sustaining medications, or putting food on the table. Parents frequently explained that they missed the appointments to sign up for Medicaid because they couldn't miss work because their employer wouldn't give them the time off, and if they did take time off, they would lose their job. This was before the new administration, and now it's even worse. So when they lost their insurance, they couldn't afford medication or doctor's visits. Sorry, that's my pack of 8 huskies that are running through the house. I apologize. So when they lost their insurance, they couldn't afford medications or doctor visits. They might go months, sometimes years without seeing a doctor to help manage their disease. And unfortunately, they would end up horrifically ill and would come to the emergency room and frequently require hospitalizations. Then the families would be saddled with astronomical hospital bills that they couldn't afford to pay. In the past, my colleagues and I would try to provide medication samples that were donated to us or given to us from the pharmaceutical companies, but that dried up quite significantly over the last year or so. Physicians across Georgia and the United States every day see how people who have consistent health care coverage are more likely to better manage chronic conditions, get care early before they become expensive, and end up with complex emergencies, and stay healthy and be productive members of our society. Simply put, access to affordable health care helps people stay healthier, be productive, and live rewarding lives. This should be a basic human right and not a privilege. By refusing to extend the tax care credits for hundreds of thousands of Georgians who get their health care through the Georgia Access Marketplace, politicians in Washington will make health care unaffordable for working families. Here in rural Georgia, there's growing concern that this will lead to closure of many rural healthcare clinics and hospitals and less access to medical care, even for people who can afford their insurance. Adding thousands of dollars to people's healthcare premiums in 2026 will worsen the financial strain so many Georgia families already feel as the cost of everything from food to gas to electricity continues to climb. Americans everywhere are terrified because President Trump and the congressional Republicans are taking their healthcare away. They're worried about how they'll manage a disease or recover from an injury or protect their children and their loved ones. Most of us worry that a single medical emergency could ruin us financially, destroying everything we've worked so hard for, losing hard-earned savings, and even the loss of our homes. This is a problem, by the way, unique to the US. In the richest country on the planet, only here in the US, people living in other countries such as Canada, the UK, or almost any other country never worry about going bankrupt due to a medical illness, but we do. President Trump and the congressional Republicans should extend the ACA tax credits to folks who buy their own health care and protect health care for low-income Georgians instead of handing out huge tax breaks to billionaires who already have more than enough. Thank you.
Thank you, Dr. Spargo. Now I'll introduce our third speaker, Dr. Gilligan.
Hi there. My name is Jennifer Gilligan. I'm in Atlanta and I'm an adult endocrinologist. So you're going to hear a lot about diabetes. But really what I want to say is that as physicians, the group of us, we're deeply concerned about patients losing healthcare coverage. President Trump's budget, which Republicans support, already cuts more than 1.1 trillion, that's with a T, from Medicaid. As a result, more than 300,000 Georgians are at risk of losing their health care with these Medicaid cuts. Georgians will be forced to go, as you've heard, without needed medication for their diabetes. This is my wheelhouse, or high blood pressure, and they're going to lose access to their physicians and their medical care teams, which makes everything fall down. Now, as many as 450,000 more middle-class families are at risk of going uninsured because congressional Republicans are taking away the tax credits that make health premiums more affordable. So for anybody struggling with numbers, that's close to 500,000. And they're doing this while they're still getting their own healthcare coverage. It's not threatened, and they're also still getting paid. That's outrageous. Families are already facing higher costs when they buy food and pay rent simply because they simply can't afford to pay thousands of dollars more every year for their health insurance premiums. We hear patients worry about whether they can put food on the table or pay the utilities because of rising healthcare costs are going to blow a hole in their budgets. My patients are often folks with diabetes. Before they even take a single pill for their diabetes, I've got to prescribe them a blood sugar meter so that they can just track their disease. Guess what? That costs money too before any therapy even starts. This is an expensive disease. And here's something else people don't know. It's 50% genetic. So a third of Congress has diabetes, and they know full well how expensive this disease is. There is little choice in receiving this diagnosis, and people should not become impoverished to manage their type 2 diabetes, among other diseases. No family should have to choose between putting food on the table or taking their child or themselves to the doctor. And I see these decisions happening every day, and it makes me sick. This is the choice of President Trump and Washington Republicans, and they are forcing this on families across Georgia. Not okay. The growing numbers of uninsured will also strain Georgia's healthcare system. I had the absolute privilege to train in one of the best hospitals in the country, Atlanta's Grady Hospital, our public hospital. It is a system doing the most with the least, as anyone from Georgia knows. It is nearly always at a breaking point. Even Grady cannot absorb what these changes will bring. No system can. When people lose healthcare, they kickstart a cascade of disasters that affect all of us. We're already hearing about hospitals planning to close down units and facing financial shortfalls that threaten their ability to stay open. In Livonia, St. Mary's Sacred Heart Hospital has already closed its L&D, labor and delivery, meaning pregnant women will have to travel further to deliver their child and get basic care so that they and their child can be safe and healthy. Hospitals across the country, particularly the South, are facing financial dilemmas, from Claxton, Georgia, across state lines to Louisiana, Mississippi, and beyond. The Robert Wood Johnson Foundation estimates that hospitals will lose $1.6 billion in revenue, with particular impact on struggling rural hospitals. And an estimated 33,000 Georgians will lose their jobs because of the ripple effects of a financially strained healthcare system. When people lose their jobs, they will likely also lose their health care. We know that. And cuts to Medicaid and unaffordable healthcare premiums are going to drive up the numbers of uninsured people, increase costs, and further strain hospitals. Because guess what? Like Dr. D'Alessio said, sick people don't vaporize. They show up. They show up in emergency rooms, and their care is so much more expensive because they're far sicker. They require hospitalization when 2 months ago they could have simply had some pills, and they enter the cycle of medical debt that comes with hospitalization, because if your hospitalization is not covered by insurance, you get a big bill at the end that you don't know what to do with. This policy choice is inhumane and unnecessary. There's no reason we're making this choice. Georgians will be sicker, poorer, and less secure because of President Trump and congressional Republicans' attacks on healthcare. Physicians stand with our fellow Georgians in calling on politicians to set aside politics, put people first, and extend the